costs that we're spending now could be taken out of the system by rules and regulations that would make their self-interest pursue our social interest.
Dr. David Himmelstein, you are for single-payer health care. Explain what it is and why you think it is achievable now.
Well, it's simple national health insurance. People pay taxes to government, and the government provides a social insurance program that covers everybody for all medically necessary care and pays the hospitals and doctors and nurses and nursing homes that provide that care. And basically, it's a program like what they have in Canada, though we spend twice what they do per person in Canada and ought to be able to provide much better care than they do in Canada. It's possible now, frankly, because this system is such a disaster, not just for the uninsured, but for insured Americans as well. We have a unanimity of interest that the system needs to be changed. Private insurance isn't working for 85–90% of us at this point. And I mean, we studied medical bankruptcies. President Obama has been quoting our study. 3/4 of the medical bankruptcies in this country, or I'm sorry, half of the medical bankruptcies in this country are people who were insured, at least when they first got sick. It's not just the uninsured. If you look at people who have coverage under the Massachusetts plan, more of them say they're worse off than better off who've gotten coverage under this plan. So the system is not working broadly, and we need to organize for change that's a broad change. Just one last thing to say, Len Nichols claims all we need is a common billing form for hospitals. We already have that. It's called UB82, and we have computerized virtually all hospital billing. It hasn't saved a nickel. It's because the insurance companies aren't actually interested in saving money on administration. That's where they bake their dime. And no amount of government regulation is going to change their behavior as long as they're still in the game.
Len Nichols, we're talking nationalizing banks. Why not nationalize health insurance? Why not nationalize health care in this country?
You know, it certainly is tempting, and at a certain level, you're right. The atmosphere is one where it seems like all things are possible. But I would just say the American people, by and large, are not ready for government-run health care. Look at the way people can be scared by one-size-fits-all kinds of rhetoric. And I will say, people it's interesting, on the coasts, people are more supportive, but in the middle of the country, they're very, very nervous about having one government program because they feel like, in the absence of great information about what's best for them, they want choice to preserve their chance of finding the best care. I think we need to improve our system. We've written extensively about that. I'd be glad to talk about it at more length. There's a lot we can do to make our system more efficient. But I think the American people are nowhere near ready to have the government take over their health care, because that set of decisions about how you treat your illness, et cetera, are so private and so emotional. They do want choice. They want to believe in their doctor, and they do, in large part, believe in their individual doctor.
So, Dr. Himmelstein, respond to that. It's not practical right now.
Yeah, well,
it's not achievable.
I mean, people want choice. People want choice. They want to be able to choose their doctor. They want to be able to choose their hospital. They want to choose their care, and that's what they can't do at this point. We're saying every American should be able to go to any doctor, any hospital in the country and have a completely free choice. And under the private insurance system, they don't have that. And I mean, this thing that people in the middle of the country somehow are idiots. Some of our strongest chapters in Physicians for a National Health Program are in places like Montana and Colorado and Indiana. And in fact, surveys show, even if you ask Americans, would you think that socialized medicine would be a big improvement on the healthcare system? Most Americans say socialized medicine would be better than what we have. Now, we're not even saying socialized medicine. We're not proposing that at this point. We're saying a social insurance program where government pays the bills, but the decisions are still with doctors and patients. And surveys are very clear. Most Americans prefer that. About 62% of Americans prefer that. Most doctors prefer that. In fact, doctors want that much more than they want lesser reforms of the kind that Mr. Nichols is talking about. It's the politicians who are the block. It's actually not the American people. And if we provide some reasonable leadership for the politicians, then they can get the message. And that's really the problem, is Washington, not the middle of the country.
Let me just make it clear. I do not think the people in the middle of the country are idiots. I never said that. What I said is they're very reluctant to sign on to a program in which they think their choices are being restricted. In fact, it is their wisdom that leads to their desire for choice. I would also say the politicians largely reflect the people's anxieties and the people's feelings about these matters. I would certainly say there's a lot of different polling out there that would suggest very different results and when you use terms like socialized medicine and one size fits all.
The politicians reflect their funders. I mean, Max Baucus, who's the driving force in the Senate at this point, is one of the biggest recipients of HMO dollars in this country. He got $200,000 in donations. The only people who got more are John McCain and Hillary Clinton. And that's the real problem, is that they're buying up the politicians. And it's not that people are scared. They're only scared when politicians try and make them scared. We're talking about increasing their choice. We're talking about paying their bills in the most efficient and effective way and giving them the care they need without the bureaucracy and interference that they now face. And there's nothing to be scared of with that, and most Americans aren't scared of that, but politicians are, because it dries up their source of funding.
And Len Nichols, I'd like you to answer that, but I'd also like to throw in a little personal experience that I've had recently. I just had a minor shoulder surgery a few weeks ago, and I have to tell you, because I am insured through my company, and I have to tell you the amount of time that I have had to spend on the phone with my employer, with the health insurer, with the hospital, the various bills from both the hospital, the surgeon, the laboratories, the amount of time that I've had to spend to try to maneuver through this incredibly complex system. And is it in network or out of network? And I have to imagine that millions and millions of Americans every day are going through the same procedure, even those who have insurance. Enormous amounts of time and energy and frustration spent trying to maneuver through this system.
Sir, I agree. I've shared some of that same frustration in my own lives, as have we all, and I would agree our current system is a mess. But what I'm trying to say is when you have a system where people only have a government solution, you're going to have a very difficult time achieving any form of bipartisan acceptance of it. And in the short run, in my opinion, that's the best way we can move forward to ensure all our people have coverage. If you change the rules, you change the regulations so that the incentive of the insurers is different than it is now. What we're talking about here is not little tinkering around the edges. What we're talking about here is changing the business model. Today, insurers make money by excluding the sick and by making it hard for people to get the care you're talking about. I agree that's what they're doing. It's about that. But if you change the rules and you say, look, we're going to publish patient satisfaction, we're going to publish what things cost, we're going to publish what it would cost to be covered by you, and make all that very clear, and you essentially give people choices among them, they will compete on the right dimensions, because that's the way they'll make money. They'll have a strong
Len Nichols, we
interest in
started
doing
with
that.
you. 15 seconds. Dr. Himmelstein, will end with you.
Well, we need single-payer national health insurance. If private insurance could solve this problem, I'd be all for it. Unfortunately, it can't. My patients desperately need it. Our nation desperately needs it. There are things we say are not appropriate for the market, like the fire department and the police department. Medical care ought to be one of those.
We'll leave it there. Dr. David Himmelstein, Associate Professor of Medicine at Harvard University, co-founder of Physicians for National Health Program, and Len Nichols, Director of the Health Policy Program at the New America Foundation. As we move now to